This class will last for about 1 hour 30 minutes or less, but we'll try and wrap up everything before 1 hour 30 minutes. That's before 9:30. So let's get started. Please, here this is the table of content for tomorrow, but we handle that tomorrow. If you're still with me, can I have a thumbs up? Please turn off your audio, just a thumbs up. All right, thank you very much. Now, Reprogence, that's about us now. It's a healthcare system that prioritizes the sexual and reproductive health of everyone. I'm sure if you have visited our website, you will get this information there. And one of the services we provide is visual antenatal care. Now, we provide that through Reprogence antenatal care, which is an evidence-based, knowledge-guided antenatal care services whose objective is to ensure that expectant mothers receive the needed care that guarantees a safe delivery. So what that simply means is that our antenatal care services deals with evidence, practical evidence. Whatever we discussed here today and subsequently, you can verify the information anywhere and you will find them to be accurate. So everyone that will be answering your question in the group as an admin, both the ones in this present group and others, are people who are licensed to practice, who knows what they are doing. All right. Like we always say, you can always verify everything we tell you here, and you will find it to be true. So the antenatal care is evidence-based and knowledge-guided. We are not doing trial and error. It's something that has been proven over time. All right. Now, this is an overview of what we have of pregnancy. That's the next slide. Please, if you can see this slide, can I have a thumbs up, please? Can see the slide? All right. Procreation is a natural law. I will have to turn off. I want to mute everybody from my end, since some people cannot mute their audio. I'll have to mute everyone. All right. All right, so let's go on, please. Procreation is a natural law. Can you still hear me, please? Can you still hear me? All right, procreation is a natural law. Now, what that simply means is that every living thing reproduce. If not, they will be extinct. All right, now imagine if human beings stopped getting pregnant in about 100 years ago. All right, the only people that you will see now will be like old people who are like 100 and above. All right, now scripturally said, for those who are Christians, in the Bible, it says you should go and increase and multiply. And there is no way you can increase and multiply without getting pregnant. Hello. All right. So progression is natural. And as long as people keep having sex, keep having intercourse, they must get pregnant. There is no other way. All right. So pregnancy comes from having intercourse, and everyone actually, we are sexual beings. So people will continually get pregnant. People will continually give, put to bed. All right. Now, pregnancy, as we know it, starts from fertilization. The moment you have that intercourse, and then the sperm travels to your fallopian tube and fertilize an egg, that is when pregnancy starts. All right. Now, the duration of pregnancy is approximately 280 days. These 280 days, it can be plus or minus, because some people might deliver before 280 days or after 280 days. And these 280 days is equivalent to 40 weeks. And I know that many of you are in your different you are in your different weeks now, in your different gestational age. We have people who are in the 5th gestational age, some are in the 18th, some are in their 30th weeks GA. All right. Now, duration of pregnancy is also equivalent to 9 months. So it depends on how you want to count it. You can count it in months, 1 to 9 months. You can count it in weeks, 1 to 40 weeks. You can count it in days. All right, 1 to 280 days. Now, if you have started antenatal, or maybe if you are a curious person that probably you tried to Google some of the pregnancy symptoms, you would have come across some of these terminologies, which I am going to explain just at the moment. Please, if you can still hear me, thumbs up, please. Let me know that we are following. Thumbs up if you are still here. Okay. Thank you very much. The very first thing that we're going to talk about now is the last menstrual period. You know, so many people, you hear of, they don't really know what last menstrual period is about, right? If your last period was on 1st of December, for instance, 1st of December 2024, and the period flew from 1st of December to 5th of December, right? The last menstrual period is the first day of the last menses, which is 1st of December 2024. So your last menstrual period is the first day of your last period. Now, it's very important because when you are pregnant now, we can use the last menstrual period to calculate, one, your estimated date of delivery, which is the date you are going to have your baby, at least approximated. And we can also use your last menstrual period to tell you how old your baby is, that's how old the pregnancy is. So last menstrual period is very important. But if you are pregnant and you don't know your last menstrual period, because we have people now, they don't even know when last they saw that period, or maybe they've forgotten the date and they just discovered that they are pregnant. Well, we can still calculate your estimated date of delivery using scan, but it will be important that you do the scan early enough. Okay, you do the scan early because early scans are more accurate in calculating your estimated date of delivery. Now, like you say, it's estimated. It can be before that day or after that day. All right. Now, we have the estimated gestational age, which I said earlier is actually the present or the current age of your pregnancy. The present or the current age of the pregnancy. That is the estimated gestational age. Okay. Now, in pregnancy as well, we have what we call trimesters. Trimesters is just a way that pregnancy is divided into 3 parts. We have, which are 3 months each. So we have the first 3 months of every pregnancy is called the first trimester. The second 3 months, that's 4 to 6 months, is the second trimester. And the last 3 months, that is the 7 to 9 months, is the third trimester. All right. Now, it's important because there are different things that we check in each of the trimesters. For instance, in the first trimester, the scan that you do is trying to show, is the baby alive? Is there fetal heart? Okay, is the baby's heart beating? And also, the first trimester scan will equally show, if everything is going on well. The second trimester scan now will be showing you if there is any malformations of the baby. All right. While the third trimester will now show you, is the baby lying well? Where is the head? Where is the placenta? Is the placenta low or not? So that is how pregnancy is divided in trimesters, first, second, and third trimester. Please, if you are still with me, give me a thumbs up. Let me know that we are still together here. All right. Thank you very much. Now, all of you take a look at this picture. Can you see this picture? I'm sure you can. This is the beautiful picture of a woman in labor. All right, this is the beautiful picture of a woman in labor. Now, I know that many of you here, a time will come when you will be like this. Either this month, next month, or sometime this year, you are going to be like this. So just enjoy this picture because when you get to this turn, all right, okay. Now, what is labor? What is labor? All right. In very simple terms, labor is the process of giving birth. It's as simple as that. Labor is the process of giving birth. Now, this definition here is a very long definition. This definition you are seeing here, but I will break it down after reading what I have on the screen. All right. Now, in the textbook, all right, or in medical school, they will tell you that labor is the onset of painful, rhythmic, or regular uterine contraction of increasing frequency and intensity, resulting to cervical dilatation, that is opening of the cervix, and effacement, which is shortening of the cervix, to the eventual passage of the baby through the birth canal. That is the textbook definition of labor. Now, let me explain what that simply means. Okay? Now, what that means is this. Labor is a painful process. Okay? Labor is painful. The pain of labor is peculiar. The pain will start gradually and get intense as the hours progresses. So labor pain does not just become very intense once it starts. No, it starts gradually. All right. Now you are having the pain because your womb is contracting. So as the womb contracts, squeezes on itself and pushes the baby, all right, the more the baby comes down. So it is rhythmic. That means maybe the pain started like 6 a.m. You had another one by 9 a.m. Another one will come maybe around 11. Then maybe after 1 hour. Then maybe after 30 minutes. So it becomes more regular and it increases as the time goes. So that is labor pain for you. Now, you are not just having pain because your womb likes to contract. No. The contraction you are having is actually producing an effect. It is making your cervix to open up. All right. So when a woman enters labor and she starts having this pain that keeps on increasing and increasing and increasing, the cervix will start opening up gradually and gradually and gradually. That is labor for you. Along the line, we are going to differentiate true labor from false labor. So let's just stay here. Now, as the cervix opens up and this pain increases, the more the pain increases, the more the womb squeezes the baby downwards towards the cervix, towards the vagina. Then finally, the baby will be born. That is labor. Okay, so you should note, can you see this picture? Thumbs up, please. Can you see this picture on your screen? Okay. Now, this picture, this is the faces of people in labor. Maybe this is just the picture of women in labor. I have some recording of women who are in labor, and the different cries that women can actually cry when they're in labor. But that one is when we are discussing in our group and all that. So it's not for this consumption. But just imagine someone being in this kind of pain. What does it mean? It means that labor is not sweet at all. Are you with me? Labor is not sweet. All right. But tomorrow, we are going to discuss pain management in labor, and you now discover that you can actually be sipping Zobo while you are laboring. All right. So you can actually be sipping Zobo. You can just be doing your thing, and then labor is ongoing. We will do that. We will discuss that tomorrow. So labor is not sweet, but it is worth it. All right. Let's go on. True and false labor. Can you see this screen as well? Please, thumbs up, please. Can you see this screen? All right. So I know that you are with me. So let's go on. True labor. True labor. Normally in Nollywood, a woman can just wake up and then she starts screaming in pain and everything, and then they just say, this one is in labor. She has. Okay, so a woman can start having pain, but the pain may not be pain of labor. So that's what we are trying to describe here. Okay, true labor usually starts now. For most times, usually labor starts from 37 weeks and above. A baby who is 37 weeks already is said to be term. That is said to be matured enough to survive outside of the womb when delivered. All right. So most times true labor starts at 37 weeks. But if labor starts before 37 weeks, it is called a preterm labor. We are going to discuss that further on anyway. In true labor, contraction begins gradually and build up progressively, like we discussed earlier. So when a woman is actually having in labor, the contraction starts slowly or starts small, and then it increases and increases and increases. All right, that's true labor. Now, in true labor as well, like we discussed earlier, when you are having those contractions, if you touch your tummy, you see that your tummy is very strong. It is firm. And then this will lead to the cervix opening up eventually. So the cervix will start opening up gradually and gradually and gradually. Then you now deliver. But in false labor, all right, so most time you will see a pregnant woman, she's having pain, she comes to the hospital, they check her, they say, no, madam, you are not yet in labor. And then they will send her home. She come back again, you're not yet in labor. Now, the pain she's having is forced labor because it is not leading to the cervix opening up. So forced labor can occur at any time in the pregnancy, especially any time in the third trimester. The contraction is not regular. So a woman may have contraction today. The next one she's going to have is going to be probably in the next 1 week or after 3 days, and the contraction is not strong. It will not build up. That is false labor. The contraction of forced labor does not lead to childbirth. And finally, you can even check out this word, Braxton Hicks contraction. Braxton Hicks contraction is false labor. It does not lead to labor. All right. Now we have term and preterm labor. If your labor starts from 37 weeks and above, it is term labor. That means when the baby comes out, baby is going to do very well outside. But if your labor starts before 37 weeks, it is preterm. And in many cases, if a baby is born preterm, such baby will need extra care in order to survive. For instance, a baby who is born at 34 weeks. And at 34 weeks, the lung have not really matured. So you know that such baby may have difficulty breathing. So you will have to maybe put them on incubator, put them in oxygen and so many other gadgets just to help their lungs to breathe and breathe and breathe. All right. So that's preterm. So that's to say labor can actually start before a woman is term, but it is called preterm labor. And we don't want that because just imagine you are carrying a pregnancy and then suddenly labor starts when your baby is not strong enough to survive, and then the baby now come out. By the time you deliver, it's a lot of stress watching your newborn, in the hospital. It's a lot of stress watching your newborn being, they are putting gadgets and all that. So, but some people may have preterm and the baby will survive anyway. So just know that we have term labor and preterm labor. And preterm labor is when labor comes before 37 weeks. And please remember that whatever question you have, just sit down somewhere. At the end of the class, we'll answer everything. Now, signs of labor, extremely important. In Nollywood, I'm using Nollywood because many of us watch Nollywood movies, right? And then see like all those the African magic epic, suddenly a woman's water will burst. They will say, she's in labor. Hey, well, a woman's water bursting is not usually the common or the first sign of labor. All right, at least for most people. The very first sign of labor is pain, contraction. So, like we have already described the contraction of labor, it comes gradually and builds up gradually and gradually and gradually. So the very first sign of labor is contraction. That means if you are pregnant and whether you are term or not, you start experiencing pain. And this pain does not want to go away. This pain is different from the normal waist pain and back pain that you used to have, or the normal contraction that used to come once in a while. But this pain will come and stay. The more it comes, the stronger it becomes. That is a sign that you are likely in labor. All right. So the first sign of labor is pain. The second is discharge of show. We know that in pregnancy, right, women have different kind of discharge. Some may have vaginal candidiasis, and then they will be discharging this whitish melon light kind of discharge. Now, when labor starts and the cervix opens, what happens is that in pregnancy, mucus blocks the cervix. So when a woman is in labor and the cervix open, that mucus that is blocking the cervix, is slimy, it's slippery, it draws, it will start coming out. Sometimes it is stained with blood. That kind of discharge, which is very slippery, stained with blood and all that, it is called show. So when labor actually starts, you discover that a woman will start discharging show. If you even examine such woman self and then your finger come out, your finger will be very slippery. All right, that is called show. Now, number 3 sign is opening of the cervix. The more a woman have pain in labor, the more the cervix open. All right. So when you are having pain and you go to a hospital and you are assessed and found to be in labor, that means that your cervix is open or your cervix is beginning to open. All right. Now, forced labor does not make cervix to open. Forced labor does not make the cervix to open. All right. The last one is drainage of liquor. Like you can tell, I say plus minus drainage of liquor. That means drainage of liquor is not common for everybody. It is not. There are some people that when they enter labor, their water will burst even before they get to hospital. Or some people that once they reach them, their water will start leaking. Okay? But for some people as well, for a lot of people, even when they are in labor, their water does not leak. All right? It doesn't leak at all. So, drainage of liquor is not the first sign of labor, and not everybody experiences drainage of liquor. And liquor is the water that the baby swims in. In the womb, the baby is surrounded by a pool of water we call liquor. Okay, so sometimes when labor starts, that balloon, that pool of water may start leaking out from the vagina. It is called liquor. So we have taken time to list the signs of labor. Number 1, I said pain, that is contraction of the womb. 2, discharge of show, which is a slimy discharge that is stained with blood. And then the other one we said cervix will start opening, that cervical opening and dilatation. And number 4, drainage of liquor. All right, can we all see this picture on the screen? If you can see, just give me a thumbs up. Can you see this picture? All right, thank you very much. Now, during pregnancy, the cervix is closed. The cervix is sealed up completely in pregnancy. The cervix is completely sealed up. But when labor wants to start, the cervix will start opening up. You can see this picture from small. We have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now the cervix will open up until 10 cm. 10 cm is said to be full cervical dilatation. So if your cervix is 10 cm dilated, that means you are fully dilated. All right. Now we are going to talk more on this in the subsequent slide. But before that, let's talk about vaginal examination. For many of you that have delivered, or for some of you that probably you had something to do in the hospital and then they had to examine your cervix, you now discover that vaginal examination is not very comfortable, right? It is not comfortable. So you now see a woman, especially all these our first timers, who they are used to their privacy, they are covering themselves up properly. So they now come to hospital, and then imagine a doctor will come and say, "Madam, I want to examine you." He say, "You want to examine where? Your vagina." It can be awkward, it can be uncomfortable. But if you are pregnant, all right, chances are that your vagina must be examined though, especially when you come in labor pain, because that's the only way to know if cervix is opened or not, or to know if you are in labor actually or not. So your vagina must be examined. So it's uncomfortable, but please, you will have to bear. All right. maybe your doctor will talk to you and try to make the experience less traumatizing. It's just uncomfortable anyway, but just know that in labor, all right, people are gonna be examined. Now, please note, okay, you are not in labor if your cervix is closed. If you heard that, can I see a thumbs up? You are not in labor if your cervix is closed. No matter how the pain is, if your cervix is closed, you are not in labor. Again, if you are experiencing contractions and the cervix is closed, it is called false labor. If you are experiencing contractions with a closed cervix, it is called false labor. So one of the parameters that means or that shows that you are in labor is when the cervix starts opening up. All right. At this point, let's look at induction of labor. Induction of labor. What exactly is induction of labor? I'm sure that many of you must have heard about induction of labor. But before we actually go to the slide that carries induction of labor, now, naturally, when a woman is due for delivery, when a woman is due, like a woman is 10, the body have a way of making such woman to start having pain, to start having contraction. It is natural. So you know, say woman, probably she's even sleeping. She might even be sleeping and suddenly the pain will wake her up. And then she will have to come to hospital even at midnight. All right? But what happens when a woman have reached the date that she's supposed to deliver and there is no labor pain? What will happen? Because of course this woman cannot carry the pregnancy indefinitely. Something has to be done. All right? So that is where induction of labor comes in. Now, induction of labor simply means it's just the manual or the artificial stimulation of labor. It is the manual or the artificial stimulation of labor. That is induction of labor. So it's as simple as that. So whereas normal labor comes naturally, you don't need any drug or any stimulation to make a woman to start having labor pain. That's normally. But when she's not having such pain, you have to stimulate the labor. It is now called induction of labor. Now, there are different methods of induction of labor. It depends on the place that you are going for your antenatal. It can be with drugs. We have drugs that can be given, maybe it can be put in the vagina or put under the tongue, and then it will stimulate a contraction of the womb. That's uterine contraction. All right. We also have people that they will pass catheter, just a small plastic tube. They will put it in your cervix and inflate it, pump it with sterile water. Then it will cause the cervix to start dilating, and then pain will come. So those are like, we have other methods as well, but these are the commonest methods of induction of labor. Now, it is not everyone that is qualified for induction of labor. Not everybody is qualified for induction of labor. So who exactly is qualified for induction of labor, and in which cases do you even start induction of labor? So we are looking at indications for induction of labor. The first is in post-date pregnancy. Post-date pregnancy. All right? This simply means when you have reached your date of delivery and pregnancy is not coming. When you have reached your date of delivery and pregnancy is not coming, all right, your doctor can actually assess you to know if you are fit for induction or not. And if you are fit for induction, you will be induced. That labor will be stimulated for you. So, for some women who have reached 40 weeks and above, they have passed their due date. The next thing is induction. Then, if induction does not work, it will now be cesarean section. The next reason why a woman might have induction of labor is fetal distress. That is, if the baby in the womb is no longer comfortable. So you now see that the baby is highly uncomfortable. The heart rate is going up, and having assessed it, they'll not be like, okay, if we leave this pregnancy to continue, this baby, you may lose the baby, so they will want to induce you. Now, the third reason is medical or obstetric reasons. There are some women, because of their medical condition, you will not want them to carry the pregnancy to 9 months. For instance, women that have hypertension in pregnancy, that's pregnancy-induced hypertension or preeclampsia, all right? Also, in women who have the tendency of having big babies, like women that have diabetes, all right, and all that. So when you now see that this woman is already 37 weeks and the baby is already getting so big, or maybe the baby is not really going to do well if you allow the woman to continue because of one medical reason or another, such woman can be induced to deliver before her due date. Another reason for induction of labor is personal reasons. Personal reasons, some women can just get tired of carrying this pregnancy. Like they are just tired. They can't continue because of maybe how stressful the pregnancy is. So you now see, because of that, they will just talk to the doctor. Doctor, Shebi, you said at 37 weeks, my baby will do well, Abi. Okay, so I want to deliver now. So for personal reasons, a woman can actually have induction of labor. I've seen people like that as well. Those that will say, I want my baby to be the same, be born on the same day as my birthday. You get? Or maybe I want my baby to have the same birthday as my husband, especially if such baby is already 37 weeks and above. So for different reasons, some can even say, doctor, I have exam, and if I should allow this pregnancy to stay in the next 1 or 2 weeks, I might miss my exam or any of those reasons. So because of personal reasons, a woman can also choose to have induction of labor, that is to deliver before their due date. Do we understand up to this point, please? If you do, let me have a thumbs up. All right. Now, having said all this, who then is not qualified for induction of labor? I did not put this in the slide anyway. Who is not qualified for induction of labor? Number one, any woman that have had one previous cesarean section is not qualified for induction of labor. If you have had one previous cesarean section, no doctor will induce you because of the risk that if they induce you, you can actually tear. That's your womb can tear. That's uterine rupture. So for such woman to deliver vaginally, she has to enter labor naturally. So induction of labor is not indicated for a woman who has a previous cesarean section. All right. Number two, induction of labor is not indicated for a woman who have a very big baby, a baby of 4 kg and above. No reasonable person will want to induce you because that will be trouble for both you and the baby, especially if things do not go as planned. So very big babies, no induction. One previous cesarean section, no induction. Again, a woman that had fibroid operation, maybe if it was a very big fibroid that actually led them to cut deep into the womb, no induction for you. Because having a very big fibroid operation is also equivalent to having a scar on the womb. That's like you had a cesarean section. So for that, no induction of labor for you. A woman who the baby is not lying well, normally baby has to come with their head, right? So if the baby is coming with bum or with leg, no induction for you. A baby that is coming with leg or with bum is no induction. Or if the baby is not lying well, maybe the head is one side or the baby is lying transverse across the womb, no induction. In fact, if the baby is lying across the womb, you can't even deliver vaginally. It has to be cesarean section. So those are like categories of people that you don't induce. Again, It's also important to know there are other conditions, like maybe when a woman have if a woman have HIV, like you have HIV in pregnancy, it is advisable that you should not be induced, because inducing a woman that have HIV is going to increase the risk of transmitting the virus to the baby. So no induction. Ideally, cesarean section is the safest for such woman that have HIV in pregnancy. Again, if a woman have contracted pelvis, maybe your pelvis is very slim, like very narrow, so that the baby cannot pass through, no induction, no, because that will be a lot of trouble. You will, in fact, at the end of the day, you'll even end up having cesarean section. So contracted pelvis, no induction. Please, this is very important, because so many of you, by the time you reach 9 months, you'll be desperate to have for the baby to come out, especially if you are not having pain. So that is why we are taking time to explain this, so that you will not make the mistake of even going to take the drug yourself, because that will be a lot of problem. All right. Now, this teaching is important because there are people who deliver women and they are not knowledgeable about these things. These traditional birth attendants. All right. They call them different names. They call them different names. These women are experts in delivering women, but they don't have this knowledge. So they will catch a woman who have a scar, who have done CS before. Especially, we are very religious people. The moment you tell a woman that you are going to have cesarean section, she will say, "God forbid, not my portion." You understand? Meanwhile, there are problems that we are facing. Then this woman may now go behind you and go to some other people that will now agree to induce labor for them. At the end of the day, the baby will die. All the 9 months suffering will just go to waste. In fact, I have even seen women that lost their life because they refused to listen to the doctor's instructions. Anyway, I hope you will not miss tomorrow's class, because we are going to throw light on cesarean section. All right. So, please, that's about induction of labor. We go over to the next slide. Now, before we go over to the next slide, because we still have a lot of things to discuss down the line. Before we go over to the next slide, let's just talk a little about Reprogence antenatal class, all right? Because we actually halfway into this class. This is just a free class. Today's class and tomorrow's class is a free class, all right? But after this class is now, after tomorrow's class and everything, we are going to dissolve that group. But we have an ongoing antenatal class anyway, which we actually interest you, because we teach all these things. And through the class, you actually have access to doctors, to midwives. You can ask questions and receive answers. We can interpret your scan, interpret your lab results. You can even consult us, one-on-one consultations and all that. So, but the only thing is that because of the effort we put in the class and the dedication of answering everybody and all that, the class is not free, unfortunately. Okay? You will have to make a little sacrifice to be part of the class. So, maybe if after today and tomorrow and all this, you are interested in being part of the class, I would really encourage you to make the sacrifice. It will cost you just about 10,000 naira only to join the class till you deliver. So if you even check the quality of the teaching you are receiving today and tomorrow, and then they say you should pay for it, I wonder how much you'll be willing to pay. So that's, by the way, let's continue, please. Stages of labor. Please, if you can see this screen, can I have a thumbs up? All right. So, stages of labor. Stages of labor. What are the stages of labor? Remember that we said that pregnancy is divided into 3. We have the first trimester, second trimester, and third trimester. When it comes to labor, labor is also divided into 3 stages. Labor is divided into 3 stages. All right. So, we have the first stage of labor. The first stage of labor is divided into 2: the latent phase and the active phase. The latent phase is when they examine you and say that your cervix is less than 4 cm. That means labor is just starting. Okay? Labor is just starting. At this time, we can't even tell you how long you are going to stay before delivery. We can't tell you that because you are still in the latent phase. Now, for some people, they can even remain at 2 or 3 cm for 1 week. As they are having the pain, and then they will just remain like that. But after a while, they can now progress into active phase of labor. The active phase of labor now is when the cervix is 4 to 10 cm dilated. 4 to 10 cm. So the moment a woman's cervix is 4 cm, all right, she can be told when she's likely going to deliver. Because ideally, the moment you are 4 cm dilated, it's expected that your cervix should be opening 1 cm every 1 hour. 1 cm every 1 hour. So that means if you are 4 cm and your labor is progressing fine, it can take about 6 hours for you to be fully dilated. That is in the first stage. But you must also know, please note very well, that the duration of labor is different for first timers, for second timers, and for people that have had multiple deliveries. Usually, for first time mothers, for most of them, the labor lasts longer. Meanwhile, labor is faster for women that have delivered before, most times. All right. Although we can still have first time mothers that will deliver very fast, but for most people, second time mothers or people that have had previous deliveries might have a faster labor. Okay. Now, when a woman's cervix is 10 cm dilated, we say that she is fully dilated. Fully dilated. All right. Now, once a woman is 10 cm, she will enter the second stage of labor. In the second stage of labor now, it starts from full dilatation of the cervix to when the baby come outside. Okay. So that means when you are told that your cervix is 10 cm, is fully dilated, you have entered second stage. This second stage is just for the baby to come out. All right. Now, for people that have had previous deliveries, it can take about 30 minutes to 1 hour for the baby to come out after they are fully dilated. But for some others, it may take 2 hours or so. All right. So just know that by the time they say that, madam, your cervix is 10 cm, you are fully dilated, that means you are in the second stage of labor, and expect your baby anytime from that time. All right. If you are delivered before, then within 30 minutes, at most 1 hour, baby will come out. But there are different factors that will delay a baby from coming out. Very important. It's unfortunate because we don't have enough time to talk about all these things, considering the short time we have. But anyway, we do the much we can. Now, if your baby is too big when you have entered second stage, labor will delay. If your baby is too big, if you have a big baby that cannot pass through the pelvis, even if you are fully dilated, it will be difficult for the baby to come out fast. But some people say it's in this second stage now, they will discover that this baby is not coming. They will spend an hour, 2 hours. And again, in second stage, the contraction is so strong. So a woman is screaming in labor, but the baby is not coming because baby is too big. All right. Those are the things that can delay second stage. Then the moment a woman delivers, she enters the third stage. So third stage begins from the delivery of baby to the delivery of placenta. All right. Third stage begins from the delivery of the baby to the delivery of placenta. So that means if your baby has come out and placenta is still inside, you are still in labor. All right, you are just in the third stage of labor because that placenta must come out. If the placenta fails to come out, it's a problem because you may start bleeding. All right, so they will have to do everything possible to bring out the placenta. But anyway, it takes about maybe 15 minutes or less for the placenta to come out. For some people, it may take up to 30 minutes for the placenta to come out. But that one is not as painful as when the baby is coming. Please, if you are still with me, can I have a thumbs up? If you are still with me, can I have a thumbs up, please? All right. Thank you very much. Thank you. Now, remember that we talked about vaginal examination. Now, let's talk about tear during labor, tear during delivery. For many of you that we deliver vaginally, I have a little bad news. You may have a tear, but don't worry, you will be fine. There are different kind of tear during delivery. One of them is episiotomy. Have you heard of episiotomy before? If you've heard, let me see your thumb, please. Episiotomy. Okay. Now, episiotomy is a cut that we can give to women when their baby is already in the vagina, when the baby's head is already in the vagina, but the vagina is too tight to allow the baby to come out. So that means you are already in your second stage. The baby is just about to come out, but you discover that the opening of the vagina, even though it is stretched out, it is too small for the head to pass through. And if they allow you to continue pushing, you may tear yourself in very bad way that will cause a lot of bleeding. So what happens is that the person taking your delivery will give you a little cut, okay, to allow for the passage of the baby. It is called episiotomy. Okay, now after delivery they will repair it. So it's better that you are given episiotomy, okay, than you have a lot of tear that will put you in trouble or that will make you to lose a lot of blood. Number 2, vaginal tear. Okay, a woman during delivery, a woman can have tear, can have different tears, can have different bruises. For people that have delivered before, I'm sure they have witnessed this. A woman can have tear and it can be uncomfortable, but it can be repaired anyway. It can be repaired. So just know that vaginal delivery can come with tear. Either we give you the tear or you can even tear yourself. Then we have cervical tear. The cervix can also tear as the baby pushes through. The one that we don't want at all is uterine tear when the womb ruptures. It is an emergency. That is why we encourage everybody to go to a facility that can handle delivery very well so that they will not put themselves in trouble. Because imagine you go to a traditional birth attendant, all these people that don't really know what to do, and they pump you with a lot of drug and then you now tear your womb. A lot of people will die from there. All right. So uterine tear is another, it's a kind of tear that we don't ever want any woman to have a tear. All right. So are you still with me, please? All right, let's go on. Okay. We are almost at the end of this class. We are almost at the end of this class. So let's just look at complications of labor. Complications of labor. What are the complications of labor? Number 1, bleeding. See, whether you are delivering vaginally or you are going to deliver your baby through cesarean section, you will lose blood. That is why pregnant women are told to always take their supplements. You must always take your supplements. All right, you must take your supplements. So that will help to build up your blood, because delivery leads to loss of blood. It can lead to massive blood loss even in some cases. So bleeding is a complication of labor. Number 2, pain and exhaustion. Imagine when you have been in pain for 12 hours during labor. You are there screaming and screaming and screaming. You know, you can easily get exhausted. You get tired. In fact, some women, halfway, they will say they cannot do this again. I no fit again, doctor. I no fit. CS. All right. That's why tomorrow we are going to discuss pain management in labor, so that if you're in a center that offers such services and you can afford it, they will do that for you. Okay. So pain and exhaustion. Number 3, tear. A woman in labor can tear. You know, we just discussed about tear, different kind of tear. All right, a woman can tear, and it's a complication of labor. Number 4, infection. Labor is a very messy thing. You know, blood and mucus and what have you. You know, it can expose a woman to infections. So it's a complication now. So of which after delivery, they don't have to treat you for infection, give you antibiotics and all that. Number 5, fetal distress. Okay, if maybe labor take time, maybe you've been in labor for a long time, the baby can get tired, because as your womb contract and relax, okay, the baby can actually get tired. So, and when that happens, if you still have some time before you deliver, it will be advisable that you have cesarean section so that your baby will be fine at the end of the day. Number 6, birth asphyxia. If you are with me, let me have your thumbs, please. We're almost done. We intend closing before 8:10 so that you can ask your questions. Okay, thank you very much. Birth asphyxia. See, to be very honest with you, every baby that is delivered must cry. You must hear your baby cry. Every baby, once your baby is born, baby must cry. If baby does not cry within the first 1 minute and it progresses again within the first 5 minutes, baby have not cried, there is problem. There is problem. So you must make sure that, one, you don't deliver at home. If you deliver at home and your baby have problem, there will be nobody to resuscitate your baby. All right. So I don't know if you have seen some children that they are 2 years, they are 3 years, 4 years, they cannot carry their leg, they cannot talk. We call them a different kind of name. Have you seen it? If you have seen it, I want to see your thumb if you've seen. A child that is 2 years plus, the child is just being dragged around, cannot carry head, cannot talk, the child behaves somehow. Most of this problem comes during delivery, because such child may not have cried after delivery. It is called birth asphyxia. So you must be in a place where once the baby come out, they will make sure that the baby cries. All right. So to avoid birth asphyxia, because imagine having a baby who cannot talk, who cannot walk, who is behaving funny. All right. That is stress now. Number 7, birth injury. Birth injury. Now, in birth injury, why baby is coming out, baby can sustain injury. Some babies, while coming out, they can fracture their hand. But the thing is that if whatever injury that a child sustains, it will not take time before it will heal. Even if a child sustains fracture of the hand, as they are trying to pull such child out, the hand will heal. But you have to ensure that you are in a place where they can easily manage delivery so that they will not cause undue injury to your baby. So baby can have birth injuries. And finally, cesarean section. When you enter labor, your goal is to have a vaginal delivery, right? That's your goal when you enter labor. But now, if at the end of the day you are not able to deliver vaginally because of so many reasons, or whatever it may be, it will come down to cesarean section. And if maybe it comes down to cesarean section, please don't say God forbid, not my portion, because both your life and that of the baby will be at stake. All right. So these are the complications of labor, and we will wrap this thing up here today. We stopped at cesarean section. So tomorrow we are going to talk about cesarean section, a comprehensive guide. Cesarean section, a comprehensive guide. So we recap what we said earlier on, because this is the end of the class. We started by giving you this overview about pregnancy, definition of labor, how to identify true and false labor, signs of labor, induction of labor, stages of labor, yes, during delivery, and then the complications of labor. And I believe that you've learned something. This is 9:01. So we have the next 30 minutes for questions. So please write in the message this thing. You can actually drop your questions. Thank you very much. And sorry, before the questions come, let me also remind you again. Let me remind you again before the questions start coming, that whatever we are going to teach you here today and tomorrow. You can verify it anywhere. And again, it is just a 2-day free class. After the classes, after tomorrow's class and all that, the group may not be very active again. But I also know that many of you are curious. You may actually want to, still have these kind of sessions. You may need a place that you can easily ask questions to receive answers and all that. So I really want to urge you, in as much as things are hard, but if you see a group like this and the kind of things we do and the testimonies that people are sharing, like I posted a link after the first class, you will actually be moved to be part of this group. So that is our antenatal class. So I urge as many of you as possible to enroll in the antenatal class, okay? It's 10,000 naira, and if you are taking yourself for a good treat, I think a medium-sized pizza is even more than 10,000 naira. So you can just invest that in your pregnancy, and you just rest assured that if you have any issue at all, any question at all, you have a place that you can always go, and we will answer you. Thank you very much. So let's go down to the question side. Okay, so the first question here is from Amarachi. Amarachi said, how can one know that her water is broken? Please, if you are still with me, let me have a thumbs up, please, while we answer these questions. All right. So Amara said, how can one know that her water was broken? Amara, if a woman's water is broken, she will see water coming out like urine. If somebody urinate on themselves, the way the water will just come out and soil their clothes, flow down their leg and everything. All right. So if your water is broken, you will know. You will just see gush of water gushing out from your body. Okay. Another question from Amara says, mucus plug without blood on it, does that one also show a sign of labor? Yes. You can have this type of show without blood stain. You can actually have that without blood stain. Now, when you have that kind of mucus plug, like those show, that slimy discharge, and they examine you, if you are in labor, your cervix will be open. If you are not in labor, cervix will be closed. So it could also be a sign of labor. All right. Now, Vera said, please, sir, is it safe to take bitter leaf and scent leaf water together? Dear Vera, what are you trying to achieve by taking bitter leaf and scent leaf water? Well, if you are taking it for blood, I don't know. I don't do herbs actually, so I don't really know. I know that people take these things. I mean, bitter leaf is something that we use bitter leaf to cook, so it's edible. We use scent leaf to cook and all that. So, but drinking it and all that, it might be good for your body. But just watch what you take. All right. Then we have another question from Anonymous. He said, I had a episiotomy during my first delivery and it didn't heal properly. In fact, the tear reopened. It's been 3 years already. Can I still get a repair after this second delivery? Very important question. These are the kind of questions that we answer in our antenatal classes. All right. Yes, Anonymous, your episiotomy, sorry that it did not heal well after the first delivery, but yes, during the second delivery, it can be repaired. At least I know that I can repair such. All right. So if you also meet someone like me, they can repair and realign your vagina. In fact, sometimes after delivery, we even tighten the vagina, especially if you are giving episiotomy. All right. Now, back to the questions that we've been answering. Becky Cherry says, can a first-time mom deliver without a tear? Yes, a first-time mom can deliver without a tear. It's possible, but some will also have tear. One coach said, can a first mom that has not been having sex still give birth vaginally? Yes, a first-time mom that has not been having sex can give birth vaginally. It's just that the sex probably helps to, maybe it is believed that having sex, especially when you are close to delivery, will maybe make labor to come fast. But with or without sex, you can deliver vaginally, please. Queenette said, what causes the death of a child in labor, please? My dear, it is a very painful thing for a child to die during labor. Very, very painful. A lot of factors. Number one, poor monitoring. If the labor was not monitored very well for them to detect when the baby entered distress, then third baby can actually die. So basically, it is fetal distress. That is why during labor, you must be monitored closely. It is very important so that once the baby shows sign of distress, the heartbeat start going up or start going down, then something has to be done. And usually when that happens, it has to fall into cesarean section so that your baby will be fine, so that the 9 months will not be wasted. So it's basically fetal distress that causes a baby to die in labor when the baby is very tired and cannot continue again. All right. We have Temitayo. He said, please, I'm a first-time mom and I'm 24 weeks gone, but I feel this pressure in my lower abdomen when I stand up after sitting for a while, even if it's just for a few minutes. The pressure is always very intense that I won't be able to stand straight for the first few minutes after standing up, and it's usually very painful, though not excruciating. Well, see, the moment like you are 24 weeks, so you are actually almost through with your second trimester. The baby is beginning to add weight, and as a first-time mom, your womb, which is getting bigger, your baby bump is stretching your pelvis. So because of the stretching and the weight of the baby, you will have all this kind of heaviness in your lower abdomen. In fact, you can even have waist pain and back pain because of the weight of the baby. And so that's basically it. It can get better. You can take paracetamol. If it gets so intense, you can see your doctor in the clinic. But it's all sign of pregnancy. Actually, it's a sign of pregnancy. Okay. Chidima P said, please, I'm a first-time mom in my early stage of my second trimester, and I don't know the features to look out for a good facility for registration. See, and this is very important because you have to find a good place for registration. Now, find out if they have a consultant obstetrician. Find out if they have consultant obstetrician, number one. Number two, find out if they have a theater facility. Number three, find out if there are doctors that can easily intervene, assuming there is an emergency. Number four, find out if they can successfully resuscitate a newborn that is having distress. Do you understand? So just find out. You can ask people. You can actually take a tour in the hospital and say that you want to register for antenatal, but you want to see their facility to know if it's something that you can actually register in. All right. Now we have a question here. This other question said, Anonymous, I have been hearing that pregnant care is good, but I wasn't given during antenatal. Can I buy it from the pharmacy? I thought that pregnant care has folic acid and some vitamins, but I've been given those at hospitals. Hope using both will not affect. No, pregnant care, see, the routine drugs is folic acid, pregnant care, and fetolate. While some hospital can even give you calcium, all right? But pregnant care as well as natal care have all those routine drugs combined in one tablet and even some other supplements, all right? So if you buy pregnant care, there is no need for you to take the other separate ones, like to take the vitamin C, folic acid, fetolate, because everything is already contained in the pregnant care. But if you are using both of them, it will not affect you in any way, but it's not necessary that you should combine both of them. All right. So back to the other questions. Um, where are we? Okay. Becky Cherry said, is taking lifting safe in pregnancy for fetal weight loss? Please, taking lifting will not make your baby to lose weight. All right, taking lifting will not make your baby to lose weight. I beg, Becky. Have you heard? Mojisola said, who are the people that tend to have contracted pelvis? Like, will a slim person have a contracted pelvis? Well, whether a slim person or a fat person or whatever, is just anatomical. All right. But some people that can have contracted pelvis is number one, very short people. Sorry for this missile that has come to short people. It's not a crime to be short. But some short people can actually have contracted pelvis. All right. Number two, people that had that maybe had pelvic accidents, or and then probably they had fracture, they can actually have contracted pelvis. And some other people that can have contracted pelvis, anybody can have contracted pelvis really. All right, but it's not very common anyway. You can have a normal pelvis and your baby will be too big to pass through. You understand? Omoru Sadat said, can anything be done to stop first labor and preterm labor? Is it possible for a woman? Okay, that's the first. Yes. If you are having first or preterm labor, please go to hospital. When they assess you, they can admit you and give you some drug that will stop that contraction. The moment the contraction stops, you will be fine, because it is the contraction that will lead to preterm delivery. Secondly, say, is it possible for a woman not having any labor sign at 37 weeks and above and be in labor? Well, some few women may not really feel much pain. You know that people interpret pain in different ways. So there are some women that may not really feel pain and they're just having some heaviness and discomfort. Then by the time they go to hospital, especially women that have delivered before, by the time they go to hospital, you now discover that, madam, your cervix is already first EMO. So, but usually labor comes with pain for at least 95% of pregnant women. Okay, so what can be done for a woman's vagina to be well open during labor? Nothing can be done. The vagina will expand as the baby comes down, but if the baby's head, just look at your vagina after this after this class. You know how small the vagina hole is. Now imagine a baby's head coming out from there. So the body expands, but sometimes it may not expand so much to allow for the head to pass through. So hence the cut. And I say that it's better to give you a cut than you have a tear. All right. Temidayo said, please sir, how can a first-time mom avoid a tear? Sorry, they will help you during labor. You can't really do anything. They will help you during labor. They will guide you. But most importantly, please, when you are in labor and your baby is coming, if you can, I know you can't really help it, Sha, but if you can help it and you don't really shake and move around like that, it may help. But most people at that stage, their head not even there again. So anyhow, they will help you out when you get to that stage. We have a question here. Anonymous said, when is it advisable to start going for antenatal classes for a second time pregnancy? Please, whether second time or third time pregnancy, you should start your antenatal class, latest at the end of your first trimester. That's to say, from 13 weeks, go and start antenatal, whether first time or second time. But ideally, from 10 weeks, you should go and start antenatal, please. After all, it's just once in 4 weeks at the initial stage. So it doesn't cost you anything to start early. It's just once in 4 weeks. All right? Lillian said, is there something a pregnant woman can do so she doesn't go into preterm labor? Well, please avoid avoid unnecessary stress. Avoid undue stress. If you are pregnant, avoid undue stress. Stress can cause you to go into preterm labor. Number 2, make sure that you are well treated for malaria. Make sure you are well treated for malaria. Malaria and other infections can make a woman to go into preterm labor. Avoid some drinks. So some of these, is it caffeine stimulants? It can make your womb to start contracting. Then you go into preterm labor. Avoid them. Okay. So what can be done so as not to have a big baby? Nothing really, but you can minimize. You can watch what you eat. Eat normally, but watch what you eat. Don't eat a whole lot of junk. Your baby might be big afterwards. And I must say, can someone who has had appendicitis surgery be induced? Yes, so appendix is not that doesn't go anywhere near the womb. If you have appendicitis, yes, you can be induced. They did not touch your womb in any way. Nothing to worry about. Blessing said, what measures can I take to avoid big baby, and how can I slim down a big baby? You cannot slim down a big baby, please. I know that people sell a lot of things. All right, they just say that if you take this one now, your baby's weight will come down. It will not work like that. All right, but eat normally, okay, and don't overdo it. Then here we have, how can a pregnant woman know the size of her baby before labor, and what is the advisable size of a baby to have before delivery to avoid cesarean section? For you to know the weight of your baby, estimated weight, you have to do scan. Ultrasound scan will show you the estimated, like we give you an idea of what the weight of your baby is. Ultrasound scan, please. And remember that it is an estimate, so that means assuming you do a scan and you are seeing 3.5, the baby can be a little bigger than that or a little smaller than that. It's just an estimate. Okay? Then, but if your baby is already getting to 4 kg, all right, that's a big baby. Okay? So even if you want to go through vaginal delivery, just bear in mind that if the labor does not progress, it's going to end up as cesarean section. Okay. There are many questions here. Please, you can ask these questions in the group. We try and answer. But let me continue. Tijani Taiwo said, can pelvic test be done before delivery? Tijani, yes, this is a very important question. There are hospitals that we do what we call pelvimetry. They will examine you to know if your pelvis is adequate for vaginal delivery. Very, very important. Thanks for asking this question. Very important. We call it pelvimetry. It can be done. All right. It will give an estimate. At least we say, okay, yeah, madam, your pelvic is normal. It's looking okay. You can actually go into vaginal delivery. Ferdinand said, is it possible to feel latent phase pain 2 weeks before the active labor begins? Well, the latent phase pain, if you mean that you are feeling the pain when your cervix is already open, well, for some people, in some very not so common cases, yes. But you know that it is called latent phase because the cervix is already beginning to open. No. If the cervix is still closed, it is not latent phase. It is a false labor. If the cervix is still closed and you are having that pain, it is false labor. It is not latent phase. But yes, if you are less than 4 cm dilated and you keep on having this pain, comes and goes, yes. But not everybody can experience that. This one said, is lifting tea and lemongrass safe for reduction of fetal weight? No, it is not, please. Onwuka is former. Good evening, doctor. At 24 weeks, if your baby is already cephalic position, will baby remain like that till delivery, or the baby is likely to change position? Well, yeah, Ifeoma, thanks for this question. You know, these are very brilliant questions that we actually handle in our antenatal classes. And unfortunately, I cannot really handle everything here, but I will try and answer you, okay? Now, the babies can turn as they like in second trimester, all right? Even if the baby is cephalic at 24 weeks, the baby can still turn and become transverse or become breech. That start coming with bum bum. But where we now take notice, when you enter 30 weeks and above, at 30 weeks and above, the baby should actually be cephalic. But even if the baby is not cephalic at 30 weeks, you don't worry. The cutoff date is 36 weeks. It is believed that if a baby has not become cephalic, that is, it's not coming with the head at 36 weeks, chances are that the baby will not turn again, because there will be no more space for the baby to turn back and start coming with head. But some people can still turn. But in most cases, if a baby is not yet coming cephalic at 36 weeks, the baby cannot. But don't worry about the position of the baby before 30 weeks, because babies can turn anyhow. In fact, you have what we call unstable life. The baby can be cephalic now. You check back again tomorrow, the baby has turned. All right. Mary Blessing said, please sir, can applying plenty olive oil in the birth canal during the second stage of labor prevent tear for a woman for a first time mom? Well, applying that olive oil can help to make that place slippery. Or at least for some people, it might help to, when the place is slippery, both the birth canal and the head of the baby is slippery, it can minimize the tear, all right, while they are guiding the delivery, all right. But there are also people that even if you apply those olive oil and all that, the baby will still have a tear, okay. In fact, some people say that you don't even apply the olive oil because it doesn't help. But most people apply olive oil to help to make the place slippery, so as to also avoid tear. All right. Temidayo said, please, sir, is Zobo good for first trimester pregnancy? Yes, Zobo is good. Drink your Zobo. Enjoy it. In fact, if you are on epidural during labor, okay, you can be sipping your Zobo while the labor is ongoing. Good tap. Is it Kenya? He said, can you shed more light on the antenatal sessions you hold, if it's enough to only register for your version? No, please, disclaimer, please. I hope you heard how I shouted. Please, my antenatal care, my visual antenatal care is number one. We will guide you, give you the knowledge, tell you what to do, interpret your lab results, answer your questions. We can even recommend a drug for you and all that. But it is visual. You need a hospital to deliver. Therefore, you need to register in actual hospital. I'm a doctor myself, and I will not advise my patients, to just depend on the visual one. No, I will not do that. So please register in a place. The visual one is that most hospitals don't have time to teach you like this. And many people don't even have doctor's contact or who to ask questions and all that. That's why we have our group. So, all right, it's not for you to now register only in our group and not register in actual hospital. So this thing is no. As for what we do everything. We teach you, we educate you, and then you have even other pregnant women that you can interact with and learn from their shared experiences. All right. Okay. Kindly shed light. Aisha Alatishe, it says, kindly shed light on how to overcome tear during labor. I think we have kind of tried to do this. Please, during labor, when you are in second stage, I know you cannot hold yourself, but please try not to really struggle with them. If they say stay one place, please try to stay one place and bear the pain. All right. And then the midwives and the doctors will do everything possible to ensure that you don't have tear, because we don't even enjoy people having tear. Imagine after stressing myself to deliver a woman, I will now sit down to want to repair her tear while she's feeling pain. It's uncomfortable. So we don't even. So every person that attends to your delivery, we have to make sure that you don't have tear. But if you have tear, they will quickly repair it, and that's why you must deliver in a hospital. All right. Mary Blessing said, can a first-time mom with a small or tight vagina give birth to the vagina? Yes, so you can. That vagina that is very small like that, it will expand when the baby is coming. Afterwards, it will go back to the normal size. All right, you can. Ijoma also said, can you lose your mucus plug more than once, like 3 times without blood and no labor sign? Well, if you are having cervical infection, it can come out like slimy like stuff, okay? But by the time you examine the cervix and the cervix is closed, then you know that you are not in labor. Usually, once the cervix open up, you will see the real show. So even if you are having a slimy discharge without the cervix being open, it is not labor, all right? And it's not show. Show is the one that comes after the cervix has opened. It comes right from inside the womb. I mean, inside the cervix, please. Grace Ikiti said, can a 31-year plus week pregnant woman take tea like Milo milk? Please, yes, it's safe. Please enjoy yourself. Milk and Milo tea, it is safe whether you are 31 weeks or 35 weeks. Ade Dunomobala said, can anything be done during pregnancy to aid the dilation of the cervix during labor? Maybe eating a particular fruit or taking medicine or whatever. No, just no. Nothing you can do during pregnancy to aid your cervix to dilate, but just ensure that you are fit. Take a stroll, walk a little. Do you understand? If your husband is around, have intercourse and all that, you're right. Just do soft exercises, pelvic exercises. It can help you during labor. It can help very well during labor. Udele Antonia said, if you lost your mucus plug a few days ago but no contraction, can one say she's in labor? We can only say you are in labor when your cervix is open. So even if you lost your mucus plug and your doctor check and say that your cervix is still closed, you are not in labor. But if they check and say that your cervix is open, let's assume 2 cm, then you are in latent phase of labor. And we say that latent phase of labor can last, you can't determine how long it will last anyway, all right? Because the cervix is just trying to open and start opening and everything, all right? So, but if your cervix is not open, you are not in labor. Onwoka Informer said, good evening, doctor. At 24 weeks, if your baby is already... Okay, I think I've answered this question. Well, kudos to me. Please, are you still with me at this point? Let me have a thumbs up, please. All right. So this brings us to the end of this class today. All right. And I'm encouraged by your turnout. Okay. This lecture that we had now was recorded. So after tomorrow, we will provide a link so that you can still revisit what we discussed. And don't forget to enroll in our antenatal classes. All right, it will be worth every penny you spend. Thank you so much. If you have more questions, let's go over to the group. We will answer. See you tomorrow, 6 p.m. first session, and then 8 p.m. second session. Join anyone that you can. Thank you so much. Thank you. Bye. Antonia, I answered your question. You said if you lost your mucus plug few days ago, but no contraction, can one say she's in labor? And I said, until the cervix is open, you cannot say you are in labor. Sorry, I answered your question, Antonia. Sorry, I answered. All right. Thank you, guys. Thank you.